Well, more children are showing up in emergency rooms with traumatic brain injuries, things like concussions sustained while playing sports. That's according to a recent study out of Cincinnati Children's Hospital. Medical experts believe this increase is due to more people understanding the danger of concussions and youth sports becoming more physically demanding. Well, joining us now with more on this and some good advice for parents is Dr. Ryan Redmond from East Tennessee Children's Hospital. Thank you for being here.
Of course.
So have you seen an increase in these sports-related concussions at Children's?
Yeah, certainly over the last decade, with the awareness becoming much more prevalent in the community and people understanding that getting your bell rung during a sporting event is not a simple get back in there and play kind of thing. It does lead to increased visits, which is good.
Yeah, it certainly is. And let's talk about what the signs are that parents can look for and when they should bring the child to the hospital.
Absolutely. So any kind of head injury that results in altered mental status, dizziness, just not feeling right, certainly vomiting, or confusion are all fit into the category of being a concussion. Sometimes those symptoms can be very transient, which means that you still need to stop playing and you still need to follow your return to play guidelines, but you can manage that through your regular doctor and home. But if those symptoms are persistent, then you need to come to the emergency department.
Okay, and when you say persistent, I mean, you're going to see some symptoms, what, right afterwards, or could it be a day or two after?
It can be a day or two after. If they're manageable and they're the kind of thing that can be taken care of with a little bit of Tylenol or ibuprofen, then for sure follow up with your regular doctor. But the biggest ones are persistent confusion and persistent vomiting, and then certainly any alteration in the level of consciousness, not being able to wake up and interact normally.
Scary stuff that doesn't go away. All right, yeah, for sure. Now, what other common sports-related injuries do you see coming into the ER?
Certainly, this is kind of the time of year because this is our, typical kind of more aggressive sports season, with football and soccer and all of those things going on. So we see plenty of broken bones, plenty of sprains and strains, and even lacerations as a result of those.
And they are getting more demanding. The competition is getting more fierce, it seems. Your kids want to play. They beg you to play. I know there's no way we can prevent these injuries, but what can we do as parents? What's the best thing to do to help our kids?
Most important things are to make sure that they have appropriate safety equipment. And that means not only well-functioning but well-fitting equipment, which is often a challenge in kids who are growing and hitting that sweet spot. The other thing is making sure that their talent is appropriate for the level of competition that they're playing in. So the draw is to always try and get kids to play at a level above their age level or above their talent level to make them better, but that is oftentimes a dangerous thing to do.
All right, we'll leave it there. Dr. Redmond, thank you as always.
Thank you.
We appreciate it, and if you have a question about your child's health, just send me an email to ltucker@wate.com, and then be sure to tune in every Thursday here on 6 News at 5:30 as we get advice for you from the doctor.